We're here to demonstrate some breathing techniques for our cardiopulmonary class as taught by Dr. Bose at Marshall School of Physical Therapy. These techniques will consist of huff-coughing, and the 5 assisted breathing techniques. So huff-coughing is really used for a patient who can't cough by themselves. Huffing is a good way to get to be able to cough again, and it's kind of a precursor. It's the same thing as coughing. It allows the mucus and secretions from the peripheral airways to get to the central airways. So patient, I want you to start out by expiring as much air as you can, but we're not going to cough. So it's going to look something kind of like this. Can you do that for me? Good, good. So now this next time I want you to do the same thing, and then on the 3rd time I want you to cough real hard as you can, okay? So make sure you force the air out. Good, we got an extra one there.
Instruct the patient to breathe normally. Place hands on the costophrenic angle. Therapist applies a quick downward force near the end of expiration to help the patient expel all of their air. Instruct the patient to have a deep inhalation, and therapist applies 2 to 3 quick downward stretches to facilitate maximal inspiration. Then tell the patient to hold their breath, turn their head, and cough. At the same time, PT provides a forceful inward and upward pressure. Patient breathe normally. Therapist places cephalic hand on the proximal shoulder and caudal hand on the lateral rib angle. Upon normal exhalation, therapist applies a downward force with the caudal hand to help the patient expel all of their air. Then instruct the patient to inhale deeply, and therapist applies a 2 to 3 quick downward stretches to facilitate maximal inspiration. Tell the patient to hold their breath, turn their head, and cough. Meanwhile, therapist provides a downward and upward pressure. Have the patient breathe normally. Therapist places one hand directly on the patient's diaphragm. Instruct the patient to take a deep breath in and hold it. Then tell the patient to turn their head and cough. Meanwhile, therapist provides an inward and upward pressure. Have the patient breathe normally. Therapist places cephalic hand on the proximal shoulder and their caudal hand directly on the patient's diaphragm. Instruct the patient to take a deep breath in and hold it. Then tell the patient to turn their head and cough. Meanwhile, the therapist provides an inward and upward pressure with their caudal hand. Therapist places their forearms on upper and lower portions of the patient's chest. Upon inspiration, therapist provides a downward stretch with their bilateral forearms to facilitate a deep inspiration. Then tell the patient to hold their breath, turn their head, and cough. Meanwhile, therapist provides a downward force to facilitate a cough.